And here we are. We're starting. I'm Maddie out there in virtual land. Okay, I figured I'd start the male. We did the anatomy. Frankly, wasn't that terribly long ago. I figured I'd touch on without going blah 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 and doing all that anatomy stuff because I mean that's obviously that's part of it. But I wanted to sort of do the foundation of physiology that was there, and I figured this was a good look, sort of a good area to start. If you remember, the semen is mostly a fluid, even though there's hundreds of millions of sperm. The reality is that most of the volume is made up of glandular secretions, the two-thirds of which approximately are seminal glands, hence the name semen for it. And again, what does this do? This is the physiology aspect. And again, you're balancing pH. It's a very pH balanced kind of approach to reproductive physiology. Viscous and alkaline, fructose, which is the only thing that the sperm motor, that's the sugar they utilize for energy. Citric acid is almost a preservative. And then we have these coagulating enzymes so it doesn't leak back out. It coagulates after it's ejaculated. And this is where the original prostaglandins got their name by a variety of local mediators, locally acting hormones that acted on the area. And if you don't recall, it's important to remember this is where that when we look, when they're in crime scenes, when they're looking for evidence of fluids, this is the yellow pigmented fluid. That's part of it. Prostate, it's not 100% clear how it does what it does. It's that milky white kind of fluid. It is slightly acidic. Yeah, the PSA, the prostatic sensitive antigen, is a big player in all of this. And I'm just reminding, we went over this, but I thought it would be good to just do this as a launch point. Plays a role. Whenever they say that, they don't know what the role is, but they know it plays a role in activation. Okay, and it's something that's added during the process of ejaculation. And again, that's the vast majority, and these are just lubricating glands. And you see a lot of that. Again, this is something that's very, very common. I mean, I had more related to my bladder cancer. Probably two-thirds, three-quarters of my prostate had to be removed non-cancerous, just because it had hypertrophy because of all the treatments I had to undergo for the bladder cancer. Not fun. And so, and these are just sort of the problems. I think my 40-year-old, soon to be 41-year-old younger son is starting to get some problems with this. As you can say, it doesn't take long. He doesn't want to get the idea that the number with a 4 is upon him, et cetera, et cetera. And I mean, it's a relatively common problem. Prostate cancer, big player for men. Again, anatomically speaking, for basically a half teaspoon to a teaspoon, if you want to think of it in hour measurements. Sperm are just imagine how tiny they are. Fructose is for ATP, etc. And again, the alkalinity is a little bit of acidity in the prostatic secretions is minimal, but really the alkalinity, this is all pH. Was really the major protector, particularly against infection, when we get to the female, is certainly is lactic acid and the acidity, the relatively low pH of the female vagina. It's a very, very important feature. And here's the semen, the characteristics, reverse peristalsis. These are all the kinds of things that play a role with regard to all that. Decreased viscosity, stimulate reverse peristalsis. Okay, a variety of things that are in there, suppressing female immune response, all of these things, and we discussed them previously. And the clotting factors, that's where that coagulating enzyme was there to prevent draining out. Which gets us more into the physiological, and there's not a lot to it. Okay, again, the male physiology is comparatively, dare I say, simplistic. Okay, because when we get to the female, we're going to spend the bulk of our time. We'll be talking mostly about the different cycles, the ovarian and the menstrual cycle. Male don't have this. Bless you. Male becomes sexually active in a sense, have the capability of being sexually active starting at puberty, and it continues through the duration of your lifespan. It starts to drop off variably. On average, 60, 70, 80, there's ample evidence of men, octogenarians, nonagenarians, 80s and 90s, bothering children. Not without necessarily, there's a certain amount of, I mean, whether that was done, it had viable sperm would be the way to express it. Whether it was done through traditional intercourse or through some, IVF or some other means. But even before the age of IVF, we had men that late in life being able to sire children. So it gives you an idea of how long the process works for those types of things. So there's a lot, and when they get into all this thing, again, the way you remember we talked about an endocrine, it's the same for the female. When we talk about this phase, we have parasympathetic and sympathetic. Parasympathetic is the excitement stage, the arousal stage, whatever the appropriate term is, and the ejaculation, which is the equivalent of climax in the female, is about sympathetic. So it's that very interesting inner workings of the two systems there together. Counting. That's right. So my A&P classes or my micro classes, I mean, we're like at the 1/3 today. Hmm? Yeah. But I don't take attendance, remember? I go and see, I wonder how many dresses got in there, because he probably takes attendance.
This is pretty good for our class.
Oh, for you guys, it's fine. It's not bad. 3, Maddie's online, that's 4, 7, 9, 11. That's not bad. 11 out of 17.
17.
Correct. I know. One day I'll introduce you to all. You're never always here at the same time. It's okay. I can take the hit. They pay me to talk. I can talk in front of anything. And so what happens is that whatever causes this, okay, whatever causes the parasympathetics, basically they cause the release of, and the principal chemical here is nitric oxide from the arterioles. It relaxes the local vascular smooth muscle, and we have the engorgement of all those, the corpora cavernosa and spongiosa, those 3 bodies, those erectile bodies that are in the penis, in the sponge, where it derives its name, the spongiform penis. So when the smooth muscle relaxes, the arterioles dilate, the cavernosa expands, and because it expands, that increased fluid that's in there retards or limits venous drainage, and so it engorges, stiffens, and the spongiosum basically does the same thing, but its job is to keep the urethra opening. Remember, the urethra is centrally placed within it, and that's more in toward the volar or the undersurface of the penis, and all the different things that can induce it. I mean, heavens, sort of self-explanatory. And then the actual, again, propulsion, the ejaculation portion, sympathetic spinal reflex, starting in all of these things. The ductus deferens, the prostate, seminal glands contract, emptying their contacts there into that prostatic portion of the urethra, and then effectively it's expelled out. Expulsion prevents the expulsion of urine or reflux of semen into the bladder because of the internal sphincter in the bladder constricts. That's part of it. And effectively that peristaltic action facilitates, in the vas deferens, it facilitates, because it's all being stored in the epididymis, you might remember. We talked about that, where they're maturing, and then that's, out they go. And fast. Remember my joke? Any faster than that, they get it. They get a speeding ticket in the school zone. I think that's clever. Because I've said it before.
Mm-hmm. Not just you.
We're all like that.
Yeah.
It's a guy thing. We're all vulgar.
Mm-hmm.
Any of you girls there that we're not periodically or sometimes overly frequently vulgar? You'd agree. Yeah, I could see you'd agree. Okay, so what happens, and you end up with surrounding muscular structures rapidly contracting, and it results in climax, orgasm, whatever, and all the things that are, and because it's sympathetic, pulse rate, blood pressure. I mean, I think we are familiar with what this is. And then what's interesting about it here physiologically in the male, ladies, what are you looking at on your, you're not supposed to do that on Wi-Fi. That was funny, wasn't it? You can get in trouble. They're going to know whose Wi-Fi it is.
They block some of those books.
What?
I'm just.
You see, just when they're using their phone as a hotspot. Are we done? Are you done over there? Thank goodness. What are you talking about?
Can you schedule a class period that not you
What? I will. You can stay after and chatter.
Yeah, we do every day.
What? I know. So that I understand. This is it's an important. It's a testable question type distinction. This idea of resolution, but muscular and both psychological reaction. Okay. Effectively, what happens, and then we have this so-called latent or refractory period, which varies. To be very fair, okay, no question it lengthens with age, no question at all. And so, I mean, you can. There's been plenty of scientific studies done with regard to these things, and that minutes to hours is variable. That can it all depends. I mean, it's a difference. I'm trying to not be. Certain individuals in certain aspects of the movie making industry are in the minutes category, if you know what I'm driving at. This has all been altered by the presence of erectile dysfunction medications that act the way they do. I'm trying to be, voila. So that should be a capital O, not a no, leading to inability to attain erection. So, and look, and this is very interesting because we didn't have these medicines before, and I think it's changed a great deal. Men were extraordinarily reluctant to say anything that they were not performing in the bedroom department, so to speak. It's just the male ego gets in the way. And so I don't know whether this is something that, and there's been a debate about that scientifically, whether this is something that has come from medicines, food sources, things like that, or in reality, it was just something people were reluctant to discuss. You guys don't have the context I do. Okay, as little kids growing up, moms and dads didn't, nobody talked about this stuff. We were immensely more open with my kids than I can remember with my mom and dad. Oh my goodness, total changes. And for a reason, because we were concerned about sexually transmitted diseases and things like that. It's different. This country is very, trying to think of the right word to describe it, has always been very uncomfortable with that type of thing. Where my understanding, if you go to other countries, they're much more at ease to discuss human sexual behavior. Things like this stuff. We're not. The word is provincial. We are very much provincial. Is the appropriate word for that. And there's lots of different factors that can play a role in it. Medications particularly so. And thankfully, these medications for many have been extraordinarily valuable. I mean, to the point where it's a giant. It's become a giant industry. Okay, other things that are part of it. These are really where diabetes being the underlying in men, particularly one of the first signs of either hidden diabetes or people who are not controlling their diabetes. It's a rude awakening for men. They all of a sudden things don't work the way they anticipate. I had patients, and we're talking about 30s and 40s, and all of a sudden it's like, oh, that's what gets their attention and takes them to the doctor. Simple as that. Okay. So other problems. You could understand it with arteriosclerotic disease. Varicose veins, I would have to be an area that I am not familiar with. And then certainly neuromuscular damage, things like that, nerve damage, underlying disease that affects nerves or demyelinating diseases. Like that. Those you all could understand. And so what do they effectively do? Any of these, and there's so many of them out there, and the sildenafil, which is the generic name for Viagra, basically they block your body's, it's like any chemical. Nitric oxide is effectively a neurotransmitter or similar in that regard. So we metabolize it. It blocks the metabolic cycle. And by doing that, it prolongs the amount of nitric oxide that's available at the site. That's how they work. The limitation is they found is that they work orally, but slowly, and then they try the ones that are like under the tongue and all that dissolve. I mean, everybody responds to them differently. That's what I can tell. So spermatogenesis, seminiferous tubules. This is the idea. It begins around age 14. Ballpark, I'd say 12 to 14. It might be fairer and very large amount daily. And so without going crazy about those, I mean, they're supporting cells, but the spermatogenic cells that are in the seminiferous tubule are there. The myeloid cells effectively, as their name would suggest, they're muscle-like, so they squeeze things out. And then these interstitial endocrine cells of Leydig, they produce the androgens that effectively become testosterone. Okay. And again, this is one of the, just because they're so similar chemically, there is some estrogen, just as there is some androgen production in females, there's estrogen production in males, which is interesting in and of itself. And so you've seen, I'm interested in histology, and I'm not so interested again in all of these, the different, depending on where you're going. I mean, we've had that discussion with MCAT students. This is the kind of thing where you do probably have to know something about those names. I'm not very good with them. Okay, this whole idea of spermiogenesis. So the stem cell is the spermatogonia. Eventually, what's produced are spermatids. Those are the immature forms that mature and become sperm. To me, that would be sufficient to remember, at least for the time being that are there. So I'm not going to go through all this stuff that's there and all that goes along. So again, the difference between the spermatids, even though they're haploid, they're non-modal, okay? And then once they effectively lose the excess of cytoplasm and form the tail, now we're getting to the part where they're sperm. Now the important part, anatomically, you have the head. Effectively, the head is the haploid genetic material. It's covered with the acrosome, which has the enzymes that are necessary for penetrating the egg. We should get to that maybe by the end of next week or last week together. And the mid piece is just basically for mobilizing the tail, and the tail basically facilitates the motility. This is the energy, and this is the motility aspect. It's pretty straightforward. There's not a lot going on. This is what they look like microscopically, bless you. They're not all created equal. For instance, a lot of problems infertility-wise, sometimes it's inadequate sperm production. Sometimes it's inadequate sperm motility. Those are things that they look at. And when they do the workup for infertility, I've had the workup done. They do they'll do a thing called a PK, which is spelled wrong. It's called postcoital. So first thing in the morning, you and your partner have intercourse, and you're trying to. And at that point, the immediately you go to no showering or anything like that. You go to the whoever the physician or the facility that's doing it, and they recoup or they obtain some of the basically the ejaculant that's there to do the sperm count to assess the motility rather, to assess whether there's things like hostile mucus, if there's some immunological phenomena, all of those things. That's a standard part of the workup. Yeah, and I don't know if it's changed. This my first wife and I had this workup in 1980. Let's say circa 80, 81, 82. That was part of the workup, as was she having a history of injecting dye at that time. Again, MRI and CT technology were early on. Hysterosalpinogram, and basically those were the kinds of things that they looked at, as well as obviously a pelvic examination. So that's what she went through, or we went through, if you will, to find out. And the reality was there wasn't necessarily a clear answer at that point in time. When we were considering in vitro and surrogate parenting, they had to assess whether they had to do a sperm sample to determine whether my sperm would freeze. Because you can't, if it freezes, and then if you're going to send that to where they were going to do the surrogate parenting or the in vitro, you didn't necessarily have to be there. They defrost it and see if it was still as active. Mine wasn't. So I had to do this at least on 2 different occasions, going to, and the procedure was being done in Louisville. That point is IVF surrogate were so new and so taboo, you couldn't even discuss it with people. The only people who you could discuss it with was like in a large, we belonged to an infertility group here in Pittsburgh. We were up in the hinterlands in Oil City. I mean, you could, if you ever said something, people look like you were defying Mother Nature other than just trying to have a baby. I know. Crazy. So that was right. It did not work. But that's. So as you can see, the process alone has a certain amount of time. Okay. And as you can see, the pressure alone pushes them in there. There's not a lot to say other than that about these. I don't think this is terribly relevant for us. The blood testes barrier is very important. We've talked about it before. Sperm, unfortunately, have different markers. So if they would be viewed as, since they form post birth, post the first 6 months after puberty, your body would look at them as being invaders. So they're not recognized as self, and they have to be separated from immunological attack. That's one of the problems when there's trauma to the area. Sometimes, some type of phenomena that might potentially expose the sperm are there. So that's interesting, at least aside. Okay, other things that are there. Testicular fluid, part of the role of these sort of supporting cells, a lot of androgens for transport, and there's different, these are parts of it. These are some of the local mediators, okay? These androgens. So in other words, normally excessive amounts of androgens, if they were there, they would act as, they would have negative feedback. This prevents that from happening, okay? And this inhibin is the other one. When the sperm count gets too high, inhibits spermatogenesis by inhibiting FSH released by the pituitary. So that's one of those. That's that interesting protein that when we get to female, for all the what kind of starts the whole idea at menstruation, all of a sudden it's almost like less sensitive to the inhibin. We'll get through that. There, same kind of illustration we saw before. Interesting. So I'm telling you about events that happened to me nearly 50 years ago. I think the problem is greater than not. My children, again, I have, so in my family, I have 3 adoptive children. My younger 2 grandchildren, my son who's in the Navy, they are both products of IVF. So they had to utilize IVF in order to have children. My wife has 5 biological children. She has the one couple that have only what couple are married, not all, but one of the couples that are married have a daughter by IVF, and use one of the eggs because very often you'll have other, just like my kids did, some reserve fertilized eggs that they keep on ice, and they went through the IVF again, and she's pregnant again. I think due in August. We had another grandchild. So the only other grandchild in my orbit like that is my daughter's now pregnant daughter. And there was no difficulty there, conceiving. How's that? I mean, so in my little orbit, 1 out of 7 is low. Lots of things, gradual decline in male fertility for years. Is that because we went there? Maybe I told you we went to at that point considered the world's leading authority, whoever makes those judgments, certainly in the elite category on infertility. It was Dr. Celso Ramon Garcia. He was at the Hospital of the University of Pennsylvania. It took months to get an appointment. He evaluated us. I mean, it was very, very thorough. All those tests were done. It took a few days. Went back to, I'm very familiar with Philadelphia, having gone to school there, we lived there, went through all that. But we were unsuccessful in whatever attempts that they made. Another couple, we were very friendly in that same group here in Pittsburgh. They went there, couldn't because they have it here, and we had gone there. They went there, were unable to see him, but saw his chief resident. They determined that she had underlying endometriosis, which is a big problem. And for some reason, they felt that chief resident felt strongly that a course of antibiotics would work. It did. So she conceived and had a daughter almost exactly at the same age as my oldest son. Fortunately, the lady in question succumbed to some kind of cancer. We have lost contact. Tell you maybe 15 years ago. Another one of those bad things about the internet. Every time I look somebody up, I get bad news. So here's other things. Foreign molecules, environmental toxins, things from plastics, pesticides, herbicides. It's a minefield out there. Other possibilities include estrogen-like compounds, antibiotics, may suppress. So let's just stop looking at those things. She didn't let marijuana. I wonder if that was me. It wasn't alcohol. But I had the marijuana covered for 7 years daily. Excuse me. We all did. Back then, as like a grandparent who was in college. Yeah, man. Other types of things that are there, etc. Yeah, it's to understand it affects that whole idea. You lose that. The whole idea of the testicles descending. Cooler is better. Boxers or briefs. And then we went through that axis. So we know the role of SSH. I'm not going to go through that. You should know that. The fact that I'm not going through that is not saying you don't need to know that. That whole GnRH, FSH, LH, testosterone inhibitor. Same thing. We did chapter and verse on that already in endocrine. So I don't see the need to go through that again. Male infant has testosterone levels 2/3. For whatever reason, in birth, I think this is just has to do for the my field success. You know, the success or the completion of development. There seems to be, and I don't know why, an early rise in early infancy, and then it recedes, very very low, and as puberty nears, the testosterone are required to. So it requires, and this is the understanding. It requires increasingly more and more testosterone to suppress the GnRH, and then the adult pattern is established. So at puberty, as the production begins to increase, it's the best way to express it. It's not clear why at certain people at certain times this occurs, but this is very interesting. So here, obviously, during fertilization, during gestation, pretty substantial, even though it lowers by the time of birth. Then that little afterwards, what is the relationship with that? I don't know. And then you can see the adult pattern here. So roughly from wherever that variable onset of puberty is, depends, all the way through, you know, if you just look at this chart, let's say that's 70, 75 years old. And then it begins to decline. Okay. So the balance takes about 3 years to achieve, after which testosterone and sperm production are fairly stable. The feeling is that it's unlikely in that early stage, maybe in that first year, not impossible, that could lead to a pregnancy. That's sort of an anecdotal feeling. I don't know that they've ever, that it would be very difficult to test that, I would anticipate. Okay, so without GnRH and gonadotropins, testes would atrophy, and obviously they would cease. And that's one of the problems. One is what if you did not know, one of the things they would do with rapists and, you know, and sexual offenders, they would basically induce suppression of that. That was their choice, as opposed to having the equipment removed. Okay. So as opposed to, you know, gelding them, as it were. Personally, I mean, just they do it without anesthesia for rapists. It works for me. I'm sorry, but then I'm okay with the cruel and unusual punishment. So testosterone, we know from cholesterol, all these types of things convert to it's in the prostate. Even estradiol, because apparently the estrogen is used more from a brain perspective. All of those, we know we know all the effects of testosterone and testosterone-like substances and what happens if they're not there. Volume declines, erection ejaculation is impaired. We can get replacements for that. I mean, all of those things. And then the secondary sex characteristics, male and female, are fairly straightforward. I don't think there's a need to review them. You can think about all those types of things. They're there. Voila, that's done. Happy days. I'm trying to think of anything I could say in summary for it. I will have to look at the questions on the final to know specifically. So I'm going to try to start cranking out these review recordings sooner than later. So I should, given that our final comes first, doesn't it? Are we in that first window? Tuesday at when?
Well, I think like 3. Like
We're in the afternoon.
Yeah.
Yeah, I think I have my micro final in the morning. Oh. 3 o'clock?
I think
Yeah.
it might be actually 3, but yeah.
Well, you'll be taking that. I'll be watching soccer. It's Champions League.
We're taking it here, right?
Yeah, absolutely. And I'll try to crank that out for you. I can't recall off the top of my head what that is all about. So the other thing, let me do this. Again, I'll just want to give me 5 minutes of introduction. We'll call it an afternoon. It's clearly more complex. I'd like to get through that. If I can get through this Monday, half of Wednesday, then I can leave the rest of Wednesday and Friday and talk a little bit about the growth and development thing, which I think is important to mention for the sake of completeness. Okay, to me, the anatomy is very straightforward. I mean, other you might remember, the only real nuance is it's not a closed system; it's an open system, in the sense that the fallopian tubes and the ovaries are not in direct contact, and because of that, when it's at ovulation, we have the potential for an ectopic pregnancy. That's about it. We're not dealing with multiplicity of glandular structures like prostate and seminal glands. Okay, we have lubrication, but that's really doesn't contribute a lot to the physiology. It's more mechanical. We have a relatively simple system. We have a vagina. We have a neck we call the cervix, just means neck. Uterus, which is basically where everything is going to be held, and then the fallopian tubes. And if the eggs and the sperm meet, we have fertilization. To me, it's not a terribly complex system anatomically. In that regard. Yes, I mean, in anatomy, we do that, the labia majora, minora, and the clitoris, and all of that, fine and dandy. But really, the physiology is the complicated aspect of this. So the reproductive role is more complex because we're dealing with the marriage of two cycles. We're dealing with the marriage of hormonal oversight from the pituitary, and we're dealing with process of ovulation and the process of menstruation. All of those things come into play with regard to that. And we don't have testosterone as one, takes care of everything. We have dual roles and differing roles for estrogen and progesterone. So that's it. So it's an internal system as opposed to an external system. And the male system is more externally located. So the anatomical differences lead to that. And there's a little piece at the end of this with sexually transmitted diseases, which I do like to cover as well. So you guys can all be very careful going forward. Trust me. Behave. I always thought that HIV was a great reason that it triggered a lot of monogamy over the years. It did. So yeah, ovaries. That's anatomy. You see, I refuse to do this again. Really, and again, I just refuse to do all of this stuff again. So you need to refamiliarize yourself with that, and then we'll look at it again. Ectopic might be something that's on there. Again, there's different types. Classic ectopic is a tubal pregnancy. This can be in the peritoneal cavity. Big problems. We'll go over a little bit about PID and the association with gonorrhea, the association with chlamydia, etc. Trichomonas vaginalis. I don't mean to be flip, about that. With prior to us hearing about this dreaded, once we heard about HIV and AIDS, it sort of turned sexual behavior on its head. Sexual behavior, starting in roughly what they call the Summer of Love in '67, the pill was something that came about in the '60s. Okay? People who started to be used 65, 66, that area. And all of a sudden, the whole idea is the only question people ask one another, what are we using to not get pregnant? Once that was established, it was I don't mean to be offensive. Casual sex was something that was common. One night stands were common. It was common. Multiple partners was common. Some people multiple partners at the same time was common. There were some very hedonistic lifestyles, to say the least. So and then what happened, all of a sudden, when people seeing that they knew getting sick, and they had no idea how it was spread, and they had no idea who it was, but they got when it became apparent, it wasn't just God's punishment for being gay. which was really one of the sort of ludicrous things that it was presented as. Then people all of a sudden start. I remember to this day they showed whoever was the chief medical officer, whatever, the Surgeon General, getting up there in front of. They had him addressed like a Sunday service at one of the big churches. All the president, all the politicians, the Reagan years. He said, "Everybody, repeat after me: condom." Because people were. I mean, it just didn't. And that's what I meant. It had changed things, so people became more conscious of barrier methods, became more conscious of monogamy, became more conscious of, making sure were tested if there was any indication. All that stuff's a part of this. It's very interesting. This is important going forward. The normal position and what happens during arousal, is you see what happens at the normal forward over of the uterus goes somewhat vertical during arousal because it facilitates the entry of the sperm. So these are all so much stuff that can go wrong. It amazes me when it works. It doesn't surprise me when it goes wrong. Again, and a lot of things. Cervical glands secreting mucus, except during mid-cycle. They're only active at that particular time. That's why that's so important. The whole cervical cancer, I can't stress it enough. Please be aware of this. I'm not curious whether you had this immunization or not, but thankfully women, I say this all the time, are much more cognizant because they have the babies of reproductive health and overall reproductive health. They get checked. Guys, don't take it the wrong way. As long as the equipment is working, they don't want to hear anything else. Don't want to go to the last thing a guy wants to do is go to the doctor and say, "Hey, I've got that kind of a problem." It just isn't. It's that. And even in the face of something that could be a problem, men tend to ignore it. Women do self-breast exams. Guys don't do self-testicular exams.
And then young boys get cortisol now too.
Yeah. Oh, absolutely. It's not a girl disease. It's a both disease. That's absolutely 100% true because the skin, the integument of the penis is very similar. It's delicate. It's the same kind of texturally, if you will. Those cells are amenable to venereal warts. It's a freaking wart, but there's certain types, and that's when that was developed. It has been relatively successful. A lot of people, the blowback was always, well, if I have my son or daughter take this down, just make them more promiscuous. Well, at least they're not getting a disease that potentially could kill them. That's my feeling with it. Let's leave it at that. So, I just wanted to spout some of the stuff that I think is important and relevant. Opinion-wise, you just have to deal